Hello, and thank you for joining me for this presentation. My name is Veronica Palleres, and I am a parent community coordinator from the Office of Family and Student Engagement, or as we are well known as the Office of the People. During this brief presentation, I will talk about substance abuse, information regarding substance abuse, as well as provide a few tips, suggestions that could assist you or a family member along the journey of recovery. We'll talk a minute about our presentation outcomes, being aware of and understanding of individuals impacted by substance use disorder, and I will refer to it as SUD. How family units are impacted when a loved one has SUD, how COVID-19 and SUDs are related, resources for individuals impacted by SUD. There are a number of questions that can be asked to determine if there could be a drinking problem. What follows is by no means an exhaustive list, but will at the very least help you start the process. If you think your loved one would be open to, ask them and get the dialogue started. Has your loved one's drinking caused problems with their relationship? Has the alcohol consumption caused problems with their work or professional life? Could they be trying to cope with a major life event or trauma by self-medicating? Have they tried to cut back or stop drinking unsuccessfully? Are they engaging in riskier behavior or putting themselves into dangerous situations? Has their drinking and the after effects of it interfered with their normal activities? Are they missing out on opportunities? Those are some of the questions to ponder. Aside from the risks one typically associated with drinking too much, there are longer-term consequences if substance abuse disorder is left untreated. Aside from the risks one typically associated with drinking too much, there are longer-term consequences if substance abuse disorder is left untreated. Let's talk about substance abuse and the increase since COVID-19. Unfortunately, the COVID-19 pandemic has brought major challenges to healthcare systems and public policies globally, as it requires intense treatment and prevention strategies to adapt to the pandemic's impact. Individuals with SUD are at risk population for contamination due to multiple factors attributable to their clinical, psychological, and physiosociological conditions. Furthermore, the family remains the primary source of attachment, nurturing, and socialization for humans in our current society. Therefore, the impact of SUDs on the family and individual family members certainly deserve exclusive attention. According to MHAW 2020, healthcare professionals dealing with substance abuse disorders must be aware of the risk and challenges they will meet during and after the COVID-19 outbreak. Moreover, addiction care must be reinforced instead of postponed to avoid complications of both SUD and COVID-19. Short periods of isolation and loneliness can have negative consequences on physical and mental well-being. Being able to discuss this with a mental health professional or family member can alleviate the heavy burden this can place on the shoulders of those who live with or are close to the individual substance abuser. In this slide, you can see the Center for Disease Control and Prevention. Let's talk about the effects of substance use disorder, SUD, are felt by the whole family. The family context holds information about how SUDs develop, are maintained, and what can positively or negatively influence the treatment of the disorder. In addition, understanding the current developmental stage a family is in helps inform assessment of impairment and determination of appropriate interventions. SUDs negatively affect emotional and behavioral patterns from the inception of the family, resulting in poor outcomes for the children and adults with SUDs. Mental health professionals such as therapists, counselors, social workers can assist in a multitude of ways. The impact of substance abuse disorder in the family and children. Environmental factors as well as genetics contribute to the evolution and development of SUDS. Haber et al., 2010. The impact will vary depending on the role and gender that the individual with the SUDS has in the family. I believe that being educated regarding SUDS will help with their development, progression, and treatment that will be needed. When family members have appropriate education and treatment for themselves, they can play a significant role in the abuser's recognition of the problem and acceptance of the treatment. So now, where do I go from here? You realize that there is a problem. So where to go from here? Please check out the resources in the following slides. Perhaps the school counselor could suggest a variety of options for you. It's okay to reach out. You can ask for your conversation with the counselor to be confidential, except for cases where your child or someone else may be hurt or may not be safe. Please review the helpful resources in this presentation. If you or a loved one are struggling with SUD, please call the Substance Abuse and Mental Health Services Administration National Hotline at 1-800-662-HELP. I hope you've liked this presentation. I've included ways to contact me should you have any questions. Thank you. Have a great evening.